Okay, research shows that 1 out of every 5 people who get whiplash suffer for more than a year. This illustrates what happens when a person gets whiplash. In simple terms, the neck is injured suddenly or violently in a jolting type of motion. Most people do get better, but today we're going to focus on people who have chronic pain from whiplash.
That hurts me just looking at that picture.
I know.
It's just, if you've had whiplash, it reminds you of that achy, awful feeling. Well, Dr. James, or Jimmy, Elliott, is an assistant professor at Northwestern University, and he's done extensive research in this field. Joins us now with more. Exciting. Also, you went to high school with Molly.
We grew up together.
Yeah.
Yes.
Did you go to prom together? No.
She said no.
I would have said yes. But we've known each other since first grade. If your mom's watching this, I want to say hi to her.
Please do. She is, yeah.
Hi.
So
hi,
cute.
Mrs. Elliott. Okay, let's talk a little bit about whiplash, because Tiffany told you right before the commercial break that she was in a car accident, right?
I've been in several.
Several.
And some bad ones.
And suffered some whiplash and still has pain from it. Is that more common than people realize?
Well, whiplash is a very common thing, right? It can happen from sporting injuries, slips and falls, but the accident that we're most excited about studying is car accidents, right? People get hit from behind. The old sort of mantra in whiplash is that majority of people recover. And that still is largely true. But we can't treat whiplash or assess whiplash as this one-size-fits-all type phenomenon. Thankfully, research that's being done not only in our lab in Chicago, but in Australia and many different parts of the world, we now have a much better understanding of who's potentially at risk for taking a little bit longer to recover. And there's some, for clinicians who may be watching the show here today, there's some key things that we can look for on our clinical exam to give us a much better idea that this is a person who may need a little bit more help.
Okay, so people who have chronic pain now, maybe from a past injury, is it something that they can benefit from this research?
Absolutely. Our research is following people from the acute stage. They get injured today. We follow them over time. But then we also have a number of research studies that look at folks who have, unfortunately, some chronic pain from their whiplash.
Let's use some images from your PowerPoint
Sure.
to help illustrate what you're talking about. So starting with the image we've already seen, this is basically what happens because you found that this is sort of the mechanics of whiplash from a rear end impact, right?
Absolutely. I mean, the old sort of school of thought was there's this rapid sort of movement of your neck. But clearly, we've learned a lot from engineers. I mean, engineers who help us manufacture smarter cars. Cars are safer today. We have head restraints that are positioned, better seat geometry. What we now know from a whiplash is that, sure, your head may hyperextend and go back rapidly, but there's this sort of non-physiological motion, if you will, that occurs soon after the injury. You're seated at a red light, you're minding your own business, you get hit from behind, and the car seat goes forward with the car. And that changes the mechanics of our neck.
It does like that S shape, right?
That's right. So we've seen now in multiple studies around the world that this abnormal sort of S-shaped curve occurs. Now, what does that mean to us as clinicians? The engineering research is great to tell us what can happen, but as a clinician, whether you're a physician, a chiropractor, a physical therapist, our job is to figure out what has happened, right? So this shows us that there's lots of tissues that are vulnerable.
What does the next picture show? Because this looks like a standard MRI, and it basically says that you can't identify from some of these traditional technology where there are lesions or problems, right?
Absolutely. Despite the knowledge we just talked about, you know, our radiologist friends, they may tell us that there really isn't any structural injury that we can sort of point at and say, yes, that's the problem. So despite the fact that we have lots of technology available to us, we oftentimes, in fact very rarely, find a lesion or an injury that we can say that's the problem. So it begs lots of questions for us in the research world is what has happened.
And the next picture, what's the importance of this one?
So years ago, we observed in our clinical practice that folks who would come in with chronic pain had these very specific changes in their muscles. This is an MRI of someone's neck, and I've highlighted the muscles in red and yellow and white just to show you the neck is a beautiful sort of area of anatomy. You've got lots of different layers of muscles, and what we found in those folks is that their muscles degenerate. They become atrophied and much smaller, and they have lots of fatty infiltrates inside of their muscles. That it appears at this stage to be unique to those individuals that transition to chronic pain.
And it's not, oh, go ahead.
I was just going to say, if the muscles kind of atrophy and get smaller, why is the pain so strong? Because I would think a lot of that is muscular pain.
It's a great question. We can look at lots of different things from that. We've shown a very strong association between clinical findings of painful presentations, but also one that has come out in the recent past is post-traumatic stress. We need to actually work in tandem with our other colleagues, psychologists, psychiatrists who specialize in that. If I'm a clinician treating that patient today and they're not getting better, I want to be able to assess for signs that they don't like cold temperatures. They have signs of post-traumatic stress, so they say, look, I don't like to drive past the accident scene anymore. I have nightmares about it. If your patient is saying those things to you, it's sort of clocking us on to the idea that maybe they need a referral to someone who can deal with that.
I want to put up our website, themorningblend.com, because I think people are going to have a lot of questions about that.
Sure.
People are going to want relief, especially people who are in chronic pain. You do studies, I know. People can volunteer for that in Chicago, and they can find out more by visiting our website and going to New Directions for Understanding Whiplash. Important conversation about it, and thank you so much.
No, it's a pleasure. I appreciate the opportunity to come on.
Great to have you here.
Thank you.